Welcome back to Grandma Needs Rehab. In this episode, we get to talk about something a little different. Yeah, why AI could be killing you. And I mean, literally. And no, this is not a joke. Happened to Grandma. And I guess the question is, how does it happen? Why does it happen? Kind of what we can do about it, what we can look out for. Well, stay tuned and we'll ponder all that. How possibly can AI be killing you in a medical and even a literal sense? Well, unfortunately, AI has become very popular for people to help interpret and understand medical issues. They're using it to help interpret and understand medical diagnosis, and they're also using it specifically for treatment guidance. In other words, trying to help guide what they feel to be better from a treatment standpoint based on what AI says, as compared to a lot of the doctors that they talk to. And I've experienced this lots over the last year in particular. But people have been using the internet now for a long time to try and uh, guide therapy and to try and understand and even diagnose kind of what's wrong with this person so that they can, you know, sometimes seek natural treatments, sometimes not seek treatment, sometimes change lifestyle issues or change whatever it may be that the AI is talking to them about, in hopes that they get better. And unfortunately, this often does not happen. One would ask then, why exactly does that happen? What drives people to look to alternate sources other than their doctor to try and determine what's wrong and what the treatments are? Well, there's actually a lot of different problems associated with that. One of them being that doctors don't explain stuff well, and it's our job to sit down with people and explain, why are they sick? What is the problem? What are the different treatment options? And kind of what's the best option for that particular person. We as providers need to do better when it comes to explaining things. Um, but at the same time, it's uh, more than that. Many times people are not particularly happy with our diagnosis. They're not happy with the fact that their loved one is doing poorly or is not doing well for whatever reason, or um, and so they often look for other possibilities. Sometimes, even though we may sit down to explain things, sometimes our providers don't explain things in ways that people would understand them. A nice way of saying that is we use big words and stuff that we hear and acknowledge and deal with every day. So we just assume that other people understand what those words mean. And the fact of the matter is they don't. A lot of people don't understand um, what we say. People need to understand what's going on with themselves as well as loved ones. And sometimes the other part of that is that many times people are afraid to ask questions. What also makes that difficult is sometimes the things that we talk about are not things that people particularly want to address. They don't want to hear a loved one is potentially dying or dying. They don't want to hear that a loved one is not going to do well. And they often seek for alternative options, because they don't want to accept some of the things that we have to say. And the reason is not usually any other reason than they're horribly worried about their loved one, and they don't want to hear bad news about them. And unfortunately, our job is not only to talk about how to treat people and how to diagnose people and kind of what to do, but there are times where we have to have those discussions. And unfortunately, I have those discussions every week, and I enjoy them no more than the people hearing them. But sometimes it's natural when you hear bad news or things that you don't want to accept or hear that you start looking for alternate opinions. And I can understand that. Why is it a big deal? Why should it matter if somebody looks up stuff, uses AI to help them come up with diagnoses and different treatment options and things like that? After all, I mean, it's out there. It's helping with a lot of other things, and what's the harm? Well, unfortunately, there's some very specific things that it does. The first thing that it does is place doubt, and doubt is very difficult when you're talking about a patient and provider relationship, because you need to trust the person that you're talking to has your loved one in their best interest. And um, unfortunately, AI really does place a lot of doubt in your mind if what AI is saying is different than what your doctor or provider is saying. And doubt can be very difficult when you're talking about trusting the person that is potentially keeping your loved one alive. The other thing I see besides doubt that is particularly concerning is when we talk about lab values and things like that, where, we see things that to us clinically don't mean much, but because they're in red or because it's outlined in yellow, uh, they be families in particular become very stuck on that. And it's a problem because people often become very confrontational. And sadly, I see this on a weekly basis too, where many times it's not the patient that's confrontational, but it's the family members where they become very angry. And they're angry because they're worried. They're angry because they have a loved one that's in the hospital that may not be doing well. And, that's very distressing. And they become very upset because of that. And then when you as a provider say that, this doesn't mean much, even though it's in red, AI says something a little bit different, many times people can become very angry with that. And as they become angry, they become confrontational. You didn't look at this, or you didn't see that, or that's not what this said. And not only do you lose some faith in what your provider is telling you, you have that seed of doubt, but then it becomes difficult to have an open conversation, because sitting down to explain why this number in red doesn't actually mean anything clinically, even though it shows up in a computer. It's very difficult to have that conversation. It's very difficult for a provider to sit down and talk to a family member that doesn't necessarily accept your opinion when it comes to things, because that's not what AI said. And as people become upset and confrontational, sometimes it's difficult for the provider to want to go back into the room for the third time that day and talk about it. And again, that's a communication issue that is on us providers as much as it is the patient and the family. So why does AI get it wrong? Well, medicine medicine is a clinical entity. It's a clinical practice. We practice medicine. So it's not a defined issue for each person. For example, renal failure in one person is not equal to renal failure in another person. And people can have four different types of heart failure. And we treat them many times differently depending on what that is. And if you get bored and you want to look at my video on heart failure, I kind of explain a little bit about that. But medicine is different for each and every single person. AI does not know the person. AI can't look at the person. AI can't look at all of the issues associated with that person. Do they have renal failure? Do they have oxygen issues? Do they have disability when it comes to ambulation, walking around, doing stuff that, is this medicine going to make it worse? Is this medicine going to make it better? Does this person have a heart arrhythmia that this medicine can increase the risk of? There's lots of different nuances to each and every person that is different. And explaining to AI what you as an individual is, what your spouse is, what your mom or your dad or your grandma, AI cannot understand all the nuances of what you as a person are. An example of that, people that have edema or swelling of the legs. Is it because of sleep apnea? Is it because of heart failure? Is it because of kidney failure? And the issue is, could it be all three of those? And the answer is, yeah, it can be all three of those. And, talking about swelling to the lower extremities without listening to the lungs, without looking at the heart, without monitoring how much urine output a person makes when they pee. These are all things that we do on a daily basis that are important to us to help diagnose somebody. Another example, if you're bored, is chest X-rays. People often come in with a chest X-ray, and because they're short of breath and they're coughing, and the radiologist will read the chest X-ray as it appears like congestive heart failure. Well, that's all fine and dandy, but when you evaluate the patient and you find out they have a fever of 102, and Grandpa Jack Jack was with them a week ago, and he got real sick and he had fevers, and they have no swelling, and their white blood count is elevated, even though the chest X-ray shows heart failure, this person actually has pneumonia. Okay. Um, if somebody comes in with pneumonia and they have a lot of lower extremity swelling, you hear a murmur. Um, you know, Now we start thinking, it was like, well, maybe this pneumonia is not really a pneumonia. Maybe it is heart failure. Okay. So there's a lot of clinical things that go into evaluating a patient, and there's a lot of clinical decisions that have to be made to treat somebody. Okay. And you don't want to get that wrong. And unfortunately, AI can't evaluate those things. I often think of it as, you would not want a blind person to pack your parachute, not because they couldn't do it, not because they couldn't make sure that it was packed, but they would not be able to most likely readily identify any problems um, by looking. This is not folded right, or this is folded, but this is tucked in wrong. I don't know much about parachutes, but I guess the other flip side of that is, if I were taking care of a patient every day and I walked in and talked to the family, talked to the patient, and never touched the person, never touched the patient, never listened to them, never listened to their heart, never listened to their lungs, never listened to their belly, never examined them physically, I think most people would be very unhappy with my treatment, and I think most people would not accept that when we're talking about, you know, someone that's caring for you or a loved one or anybody in your family for that matter. So how does this all kill you? Well, unfortunately, a lot of the things that we talked about so far, when it comes to lack of communication, when it comes to lack of confidence in your provider, a lot of that will ultimately dwindle down into, do I take my medication? People don't take their meds because they don't believe in what we said. They don't take their medications. They don't, a lot of times, don't even pick them up because they don't believe that they were diagnosed properly. They stop making follow-up appointments. And can those things kill you? And the answer is yeah. Yeah. Unfortunately, it happens a lot more than you'd think. Is there anything that AI can do? Is AI good for things? And the answer is absolutely. One of the things that it can do is it really can help explain certain diagnoses. So what is atrial fibrillation? What is a cerebral infarction? What is a transient ischemic attack? These are all things, when you look them up, it will definitely help maybe understand things. Although I I kind of hate the fact that people would need AI for that. I really think that's something that we as providers need to address better. AI can help formulate questions. Sometimes people don't know what to ask, especially when a loved one is very sick, and they're dealing with a diagnosis that is not common. Um, Especially when we talk about things like cancers, when we talk about things like sepsis and things like that. Sometimes explaining those, or at least helping a patient or their loved one come up with questions that would be very directed, that would be very helpful, because sometimes people just don't know what to ask. And as a provider, when you walk in that room, the last thing we say is usually, do you have any questions? Or do you have any questions about anything we talked about? And sometimes the answer is no, because on the spot, people can't think of a question, and they have lots of questions, but they're upset and they're confused, and it's difficult because they don't know which ones to ask. And sometimes it just eludes them at that moment. But AI can help it. AI can help them not only with questions, but help them write them down, so that way when we do walk into the room, we can start that conversation. In closing, the question is, is AI bad? And the answer is no. I think AI can be the future of many things. Uh, but can AI kill you? And the answer is yes. I think if we look at some of the issues associated with AI and specifically medicine and the issue with diagnosing and treatment and things like that, as well as the provider patient relationship and some of the downsides that can occur because of that. Can AI kill you? And the answer is AI can definitely alter your decision making process, which can then alter how you do things, which, yeah, it can kill you. So if you have any questions, if you have any problems, if you're not satisfied, talk to your doctor. They're there. Give them questions. Use AI to come up with questions and all those other things. But for whatever you do, make sure that you don't use AI to diagnose. Make sure you don't use AI to treat or to direct the things that you're going to do. Talk to your doctor, talk to a real provider. Let them examine you, let them examine your loved ones and come up with a plan. And if you don't like that plan, talk to another provider, but don't use AI for that.